So good morning all. Today we'll see the temporal bone. Okay. So the temporal bones are a pair of pneumatic bone and it is irregular in shape and it is situated on either side. See, this is the right side temporal bone and here you can see the left side temporal bone. So it is a pair of irregular and pneumatic bone, okay, situated on either side of the skull. And if you see the temporal bone, it is present between the sphenoid bone in front. See, this is the sphenoid bone in front and behind you have the occipital bone. So your temporal bone, it is present between the sphenoid bone in front and the occipital bone behind. Okay, now the subdivision of the temporal bone, it has got the squamous part. Okay, this is the squamous part of the temporal bone and here you can see the mastoid part along with one process, that is the mastoid process. So this is the first part, that is the squamous part, and this is the second part, that is the mastoid part along with the mastoid process. And next you can see here, see this is the external acoustic meatus. So surrounding the external acoustic meatus you can see small bed shaped part, that is the tympanic part of the temporal bone. And you can see here, see this is the petrous part of the temporal bone. Okay, so this is the petrous part of the temporal bone. So these are the four parts of the temporal bone: the squamous part, mastoid part, the tympanic part and the petrous part of the temporal bone. This much it is the petrous part of the temporal bone. Okay, so we'll see individually. So if you see the squamous part, it is a thin. See here you can see the individual temporal bone. Okay, so we have removed only the temporal bone here. So this is the squamous part. We are going to talk about the squamous part. Squamous part, it is a thin translucent plate of the bone which project upward. Okay, so which project upward and forms the side wall of the skull, and it also forms the floor of the temporal fossa. You have already studied the temporal fossa and infratemporal region and all. So it forms the floor of the temporal fossa, and this squamous part, external surface, it has got an external surface. Okay, so this squamous part, it forms the floor of the temporal fossa. So if you see the squamous part, it has got an external surface. See, this is the outer surface or the external surface, and it has got an internal surface or the inner surface. We are going to talk about only the squamous part. It has got a superior border and the antero-inferior border. Okay, so the superior border above it will continuous with the temporal fossa. Okay, above it will continuous with the temporal fossa. Here it provides attachment of the temporalis muscle. Okay, now the lower antero-inferiorly, so below it will continuous with the lower limit. So we have already seen the upper limit of the superior border of the squamous part. Now the lower limit of the squamous part, which extend about 1.5 centimeter below the supramastoid crest. Okay, now we have finished the superior border and the antero-inferior border. Now we are going to see the external surface of the this squamous part. What all the features you can see on the external surface? So first of all you can see here external acoustic meatus. So just above the external acoustic meatus, see, just above the external acoustic meatus you can see a small, in another bone I will show you. See here you can see, here it is, this is the squamous part of the temporal bone. Features, you can see the external acoustic meatus. So the most anterior part of this area of the squamous part, which forms the roof and the upper part of the posterior bony wall of the external acoustic meatus. And just above the external acoustic meatus there is a small triangular depression. See, this is the small triangular depressions known as the suprameatal triangle. Okay, so you have already studied the suprameatal triangle in the norma lateralis classes. So it is the commonly asked the spotters question. Okay, spotter question. So here they will color this area. So identify the colored area and mention its boundaries and what all its clinical importance, all that can be asked. Okay, so just above and behind the external acoustic meatus there is a small triangular shaped depression is known as the suprameatal triangle. It is also called as the McEwen's triangle. Okay, now what are the boundaries? Just I will revise once again the boundaries of the McEwen's triangle. It is actually this McEwen's triangle or the suprameatal triangle. It is formed by the squamous part of the temporal bone, and it is bounded above by the supramastoid crest. So this is the supramastoid crest. It is bounded above by the supramastoid crest, and that is above, and in front by the margins of the external acoustic meatus, and behind by a vertical tangent which drawn along the posterior margin of the meatal orifice. Okay, now what is present deep to the suprameatal triangle or McEwen's triangle? So the mastoid antrum lies deep to the suprameatal triangle at a distance of about approximately 12 to 15 millimeter in adult. Okay, so in case of adult, deep to this suprameatal triangle approximately 12 to 15 millimeter deep, you can see the mastoid antrum, and this triangle is corresponds with the see this suprameatal triangle. In case of, but in the newborn, what will happen? The distance between them, it is only 2 millimeter. Okay, so the deep to the, in case of the newborn, the 2 millimeter deep, you can see the mastoid antrum. Okay, then what will happen? See this this distance increases by about 1 millimeter in every year, and until it reach the normal adult position. That is what will happen for this suprameatal triangle. That is the applied anatomy of the suprameatal triangle. Okay, so that is the one feature you can see. So this is the external acoustic meatus, and you have to tell about the suprameatal triangle. Okay, so next it is the, you can see one process over here. So that is the zygomatic process. So this zygomatic process which project forward, see, which project forward and laterally with a with a broad base. Okay, with a broad base which project forward and laterally from the external surface of the squamous part. Okay, then it has got this zygomatic process has got a concave upper surface. See, this is the concave upper surface. Okay, then it has got a concave lower surface. So this concave upper surface, it transmit or it convey the tendon of the, I told you this temporal fossa, you have already temporalis muscle. So the tendon of the temporalis muscle will be conveying through this the upper concave surface of the zygomatic process. Okay, now the lower part you have the mandibular fossa. This is the mandibular fossa where the head of the mandible or the condyle of the mandible will articulate and forms the TMJ, temporomandibular joint. Okay, now this lower part or the mandibular fossa, it is bounded by, you can see here, this is the anterior root and this is the laterally you are having the posterior root. Now this anterior root you have one tubercle that is called as the articular tubercle. Okay, now this posterior root, it extends, it forms an arch. So it forms an arch and it forms a rudimentary posterior glenoid tubercle. This is the anterior root and this forms the posterior root on its lateral aspect. This will bound the mandibular fossa. Okay, now this is the anterior articular tubercle and posteriorly you have the posterior glenoid tubercle. Okay, now this both the anterior and the posterior root will meet laterally to form a tubercle. Both the anterior and the posterior root will meet laterally and forms this tubercle, and after that this zygomatic process, okay, this zygomatic process change its direction and it will pass straight forward. After that this zygomatic process, it will pass straight forward with a slender projection and it has got a serrated anterior border. Okay, so if you see here, you can see one suture. Okay, so this is the serrated. It forms an anteriorly, it forms a serrated anterior end. So later what will happen? This zygomatic process will articulate with the, okay, so it will articulate with the, with what? That is the temporal process of the zygomatic bone. See, this is the zygomatic bone. So it will articulate with the temporal process of the zygomatic bone, and it complete the zygomatic arch. Okay, so we have seen the temporal process, the zygomatic process. So you have seen the upper surface, grooved upper surface. It transmit the transmit the tendon of the temporalis muscle, and the lower surface it forms the mandibular fossa. Now if you see the borders of the zygomatic arch, it has got the upper border or the upper margin. It is very sharp and gives attachment to the gallia aponeurotica. You have already studied the scalp and the layers. So it gives attachment to the gallia aponeurotica, and it is also more medially to temporal fascia. Okay, so these are the attachment of the upper border or the upper margin of the zygomatic arch. Now if you see the lower margin of the zygomatic arch, it is rough and it gives attachment to the masseter muscle. It gives attachment to the masseter muscle. Okay, now next, okay, so that much is about the grooved upper surface. Next, if you see the mandibular fossa, okay, so this is your mandibular fossa. Okay, see here. See this mandibular fossa, it presents an articular area in front. So this whole thing, it is the mandibular fossa. This mandibular fossa has got an articular area in front. It is formed by the same squamous part of the temporal bone, and it has got a non-articular area behind. It is formed by the tympanic part of the temporal bone. So this whole thing, it is the mandibular fossa. Okay, this mandibular fossa has got anterior, you can see here, see this much, it is the articular part. It is formed by the squamous part of the temporal bone, and posteriorly it has got a non-articular part, and it is formed by the tympanic plate of the temporal bone. Okay, now between the squamous part and the tympanic part, there is a, see here you can see one fissure which intervene between the squamous part and the tympanic part of the temporal bone. You can see the fissure, that is the squamotympanic fissure. All of you can see, right? See this fissure. Okay, so that is the between the squamous part and the tympanic part. So that is the squamotympanic fissure which intervene between the squamous part and the tympanic part. Now this fissure, it is subdivided by, can you see a small tooth-like projection which is coming from above and directing downward? So now this fissure is subdivided by a downturned edge of the tegmen tympani. Okay, tegmen tympani from the petrous part. Okay, tegmen tympani from the petrous part into, see this bone, it is the downturned edge of the tegmen tympani. Tegmen tympani, it is the part of temporal, this petrous part of the temporal bone. That we'll see later. Okay, so this will divide the squamotympanic fissure into, so previously it was squamotympanic fissure. Now this downturned edge of the tegmen tympani is going to divide the squamotympanic fissure into two. So what are they? So it is going to divide the petrotympanic fissure behind. This whole thing they are going to divide. See behind this much part we call it as, that is petrotympanic fissure. Before it was squamotympanic fissure. Now this is the tegmen tympani from the petrous part. So petrotympanic fissure in front, and anteriorly you have the petrosquamous fissure. This much it is the petrosquamous fissure. Okay, so now it is more clear, I guess. So here you can see that this much was the squamotympanic fissure. Now this downturned edge is going to divide the squamotympanic fissure into that is the petrotympanic fissure behind and the petrosquamous fissure anteriorly. Okay, now this petrotympanic fissure is very, very important. So they will put the probe and see, they will put the probe and they will ask you identify the probed fissure or probed space and mention the structure transmitting through the fissure or probed space or something, whatever they can ask. Okay, so try to identify this. See, within the it is present between the articular part and the non-articular part of the mandibular fossa. You can see the petrotympanic fissure. Now, what all structure it transmits? See, this petrotympanic fissure transmit the cauda tympani nerve. Exit of the cauda tympani nerve. Cauda tympani is from the facial nerve. Okay, so the one structure, so that is the cauda tympani nerve, and entry of the anterior tympanic branch of maxillary artery. Entry. Okay, so the cauda tympani nerve was coming out through the fissure, and next it is the one artery, that was the anterior tympanic branch of maxillary artery. So it is entering into the cranial cavity through this fissure, and the passage of anterior ligament of malleus. Okay, passage of anterior ligament of malleus. So these are the structure which coming out, or the structure, you can say structure passing through the petrotympanic fissure. Once again I will repeat, that are the exit of the cauda tympani nerve and the entry of the anterior tympanic branch of maxillary artery, and also the passage of the anterior ligament of malleus. Clear, all of you? So whenever I am explaining something, you please try to note down this. Okay, so next it is the non-articular part. So the articular part of the fossa, this articular part of the fossa, it including the articular tubercle, receives the head of the mandible, and it forms the temporomandibular joint. Let me take one mandible. So I'll just show you how it will articulate. See, this is how it articulates. Okay, so this is the mandibular fossa. So in the mandibular fossa, you can see this is the condyle of the mandible. Okay, condyle of the mandible will articulate with the articulate in the mandibular fossa. Now this it receives the head of the mandible, and it is separated by a fibrocartilaginous articular disc and forms the synovial TMJ. Okay, so that is temporomandibular joint, and now this disc, articular disc, will divide the TMJ into an upper menisco-temporal compartment and lower menisco-mandibular. All that you will study in the TMJ classes. Okay, just for the time being, you should know this mandibular fossa will articulate with the condyle of the mandible and forms the TMJ. Okay, now so that's all about these are the features you can see on the external surface. Once again I will repeat. See, this is we are talking only about the squamous part. Okay, so this squamous part, it has got the superior border and the antero-inferior border. It has got an external surface, and it has got the inner surface. It has got an inner surface, and it has got, okay, so the external surface, what all the features, borders, anyway it will continuous with the temporal fossa, and this here you can see the attachment of the temporalis fan-shaped muscle, that is the temporalis muscle, that you have to remember. Then next it is what all the features. So first of all, the external acoustic meatus, and then you can see the suprameatal triangle or the McEwen's triangle you can see, and next comes the zygomatic process, how the zygomatic process will become the zygomatic arch. See, this is called as, see, this is the temporal bone, right? So from the external surface of the temporal bone, one process which is going towards the zygomatic bone, so we call them the zygomatic process of the temporal bone. Understood? See, this is arising from the temporal bone which is going towards the zygomatic bone. So this much it is from the temporal. So this part we call it as the zygomatic process of the temporal bone. See, if you see here, again you can see this is the zygomatic bone. So this zygomatic bone, one process which is going towards the frontal bone and another process which is going towards the temporal bone. So this is the frontal process of the zygomatic bone. We call it as, this one we call it as the temporal process of the zygomatic bone. Okay, so temporal process of the zygomatic bone. Clear all of you? That's how the zygomatic arch it completes. The zygomatic process has got the upper surface and the lower concave surface, and upper surface it transmit the temporalis muscle and the lower surface the mandibular fossa, and the borders, if you see upper border and the lower border, upper border is sharp and gives attachment the galea aponeurotica, lower border it is rough and gives attachment to the masseter muscle. Okay, so muscles of mastication, lower border gives attachment to the masseter muscle, and so that's all about this process. And next comes the mandibular fossa. Mandibular fossa has got an articular part and the non-articular part. Between the articular part is formed by the squamous part and non-articular part it is formed by the tympanic part. In between these two there is a fissure, that is the squamo-tympanic fissure. Now this squamo-tympanic fissure is going to divide by the tegmen tympani of the petrous part of the temporal bone into that is the petrotympanic fissure and the petrosquamous fissure. Petrotympanic fissure, what are the three structures traverses? Then that much you should know. Now if you see the inner surface or the internal surface, okay, so you can see here, this is the internal surface of the, see this is the temporal bone, right? So the internal surface of the temporal bone, okay, the internal surface of the temporal bone, it is concave, and it is marked by many impression for the gyrae of the temporal lobe. So the inner surface, it is occupied by the temporal lobe of the cerebral hemisphere, and also you can see the anterior and the posterior division, groove for the anterior and the posterior division of the middle meningeal artery you can see. And okay, so that is all about the this internal surface. Mainly it is occupied by the temporal lobe, and also you can see the groove for the accommodation of the posterior, anterior and the posterior division of the middle meningeal vessels. And as I already told you, superior border it is convex, so nothing much, and it has got an antero-inferior border. Okay.